impacted by the coronavirus. What changes are being made?
A Metro Atlanta church is practicing what they preach during this coronavirus crisis. I'm Mike Dunstan, how they're helping the community and also trying to keep the congregation safe.
With hand sanitizer in high demand, this distillery is getting creative and giving back to those on the front lines.
Coronavirus concerns growing tonight across Georgia and the country. Thanks for joining us at 9. I'm Sean Gables.
I'm Brittany Miller in for Rick Fallbaum tonight. The number of coronavirus cases in Georgia rising again today. Right now, there are at least 146 confirmed cases with 1 death. There are now more than 5,700 confirmed cases in the U.S. with at least 1 in all 50 states. At least 100 Americans have died.
Right now, state officials say they can test up to 100 Georgians per day with plans to increase testing to 200 a day by the end of the week. But when it comes to testing and getting that test, where do you go? CBS 46's Trayson Bragg live tonight at Jim Miller Park in Marietta. Trayson, you have some answers tonight.
That's right, Sean. Well, the Cobb County's health department will be shutting down a portion of the park you see behind me tomorrow to test a group of people for the coronavirus. That group was actually referred to the county by a number of doctors. But the big question is, where do we go if we want to test? It's the question that's growing more popular by the day.
Do you know where to get a test?
No.
That's the test for COVID-19, aka the coronavirus.
No, to be honest.
From what I understand, there's been like a circle of confusion directing people to other places. Like if you go to the emergency room, they're going to direct you to your primary. If you go to your primary, they're going to redirect you to another place.
So I decided to throw on the plastic gloves and call a few urgent care facilities in the area.
If I wanted to come in and get a test for the COVID-19, can I do that?
No, sir. Well, unfortunately, we don't do the testing for the COVID-19 here. No, sir.
Oh, why not?
Because we don't do it.
Oh, okay, so there's no way you guys can do the test.
Correct.
Out of the 10 facilities I called, only 4 said they could test me. So I called the state's phone line dedicated to providing information about the coronavirus.
They should not be saying they can't test because every healthcare facility is capable of taking a swab.
In fact, the representative on the line run by the state's health department told me every medical professional should be able to perform the test. After taking a nasal swab, doctors are asked to call the same line I called. Now get this, once doctors take that nasal swab and they call the line, they're actually going to be given a link and a request form from the state in order for them to be able to send your sample to the state's health lab. But this is an important bit of information as well. Only people who are exhibiting symptoms of the coronavirus and have been already evaluated by a doctor will get that test. Sean?
Trayson, what about for those who want to go to the emergency room to get tested for the coronavirus? Is that recommended at all?
Well, a state official I spoke to today says no, do not go to the ER to get your test for the coronavirus unless you are experiencing emergency warning signs of the coronavirus. Sean?
Good advice, Trayson. We appreciate that update. We'll see you tonight on CBS 46 News at 11. We have breaking news tonight. Governor Brian Kemp making sure first responders are fully staffed. Kemp says the state health department is extending the deadline for nearly 3,400 EMT and paramedics whose licenses would have expired at the end of March. That deadline is now June 30th.
Meantime, the Trump administration working to provide relief for families and businesses impacted by the coronavirus. CBS News says